PathCare started in 1922 when Patrick Mulligan came out to South Africa from Ireland, and he was the first private pathologist in South Africa. And just after the war, his son Terence joined the practice, and a bit later in 1967, Nellis Bayers joined Mulligan and the practice became Mulligan and Bayers. I qualified in 1972 as a pathologist and I joined PathCare in February straight after that. The practice was the first in bringing innovations to the country. Not only was it the first private practice, but things that we take for granted now started in Mulligan and Bayers. PathCare was the first company in Africa to be computerised. Because the technology was there, we took advantage of that technology and grew the practice before any other practice in South Africa. And PathCare usually is the first to have a technology in this country. And that is one of the reasons PathCare grew. And we grew bigger and bigger and bigger. PathCare is by far the dominant pathology private practice in the Western Cape.
PathCare is an amalgamation of laboratories originally brought together by Bruce Dietrich in South Africa and Namibia, and is now a group of laboratories in Southern Africa, Kenya, Nigeria and the Middle East.
PathCare gave access to people all over Africa to top-class tests and results within 24 hours. Those countries did not have proper pathology services. So by opening up PathCare Kenya and PathCare Nigeria, we gave those countries a laboratory internationally accredited where they could get accurate results at a reasonable price, and most important, they could get the results quickly.
PathCare has over 60 laboratories, many of them 24-hour laboratories, and about 120 phlebotomy centres in Southern Africa. The tests that are done at this reference laboratory are done on the Beckman-Coulter chemistry immunodiagnostic autoline system. Most of the endocrinology, the serology and chemistry tests are done on that system. Probably the most exciting technology that we are currently using in the molecular lab is the Abbott Plex ID, which was the first Plex ID system put into a private pathology laboratory anywhere in the world. What that system uses is a mixture of PCR and mass spectrometry to identify a wide range of pathogenic organisms within ours.
Yes, we're all about technology, we're all about analytical systems in the laboratories, and much of that has been very well sorted out. But the places that we needed to improve were what happened to the patient sample before it got to the laboratory and after it left the laboratory. And that involves people, many people at each step of the process. So the people implement the processes and the two have to work together.
Pathology is vital in 70% of cases for the clinician to decide how to proceed with a patient. Digital media such as the PathCare app has made a huge difference because the results are immediately available to the clinician. The results are very important to decide what the disease is and how to treat it.
In South Africa, PathCare operates as a partnership, as is required by the Health Professions Council. Having partners who are drawn from pathologists means that you have people who are not just workers in the business, but have an interest in making the practice survive and thrive. And when I came into the position as CEO, the initial objective was to try and create a common identity for PathCare. And it was very evident that people believe very passionately the patient needed to be the final beneficiary of whatever we did.
The CARE values, that's actually the acronym that we have in terms of values. The C stands for customer focus, that patient care is priority, that we treat each specimen when it comes in here as part of the human being. And A stands for accountability. R stands for respect, that we treat everybody with respect. E stands for ethics, that we actually have ethical standards that we need to maintain as an organization when we are involved in this business of patient care. And part of my job responsibilities is to make sure that our values that we have as PathCare, that is care values, that we are able actually to continue, that they bind us together, and we are able actually to demonstrate also our values to the outside world and also in our own country.
Our Data Care initiative started by us recognizing staff members within PathCare who were already contributing to their societies in places of need. We organized the Data Care project where PathCare contributes to projects which we find worthwhile, and we encourage all members in PathCare to get involved in projects.
When we recruit, we make sure that the people that we recruit, they match our values, and they also have the technical skills that we need in our organization, by making sure that when they are also in the organization, we actually take them through our training academy.
The PathCare Academy was the first place in South Africa where phlebotomists were trained. Also, we developed a course in lab technicians, lab assistants.
The Academy, through its recruitment processes and training, has been producing staff with the best attitude as well as the best results in the country, year after year.
Dit was nie moontlik geweest vir my om verder te leer nie. Die geld was nie altyd beskikbaar nie. Ek het myself beloof dat wanneer PathCare my die geleentheid gee, dan sal ek die beste van my vermoëns maak. En ek het nie geweet ek gaan nasionale topstudent behaal nie. Dinge het vir my so verander vir die afgelope 2 jaar dat ek kan nou bekostig om my eie plekkie te huur ook. Dit verander jou lewe om verder te leer.
The way I actually see the future for us as an organization is that we will actually have to continue investing in people development. Our academy will actually have to change from just being an asset for PathCare, that it actually have to become an asset for the country, where we can actually grow people, develop people who can actually be utilized by the health sector industry in South Africa.
The future of pathology is very positive, and the future of PathCare is very positive in that we are sitting in Africa. We see that Africa is a continent of opportunity for the next millennium. We believe strongly that pathology has a value in the medical algorithm, in the healthcare environment in Southern Africa and in Africa.
PathCare has come a long way. It's grown by acquisition and by organic growth, but its keystones set by Mulling and Bayes remain the same. That is high quality and value for money, and put the patient first.